The number of cholera-related deaths in South Africa stands at 43 since the outbreak. According to the Department of Health, South Africa has recorded 1,045 suspected cases of cholera in 15 out of 52 districts across 5 provinces, 197 of which were laboratory confirmed. Gauteng remains the hardest hit province at 89%, with 176 cases reported in 3 districts. The province is followed by the Free State, which accounts for 6%, with 11 cases reported in Fezile Dabi District, while the Northwest has logged 5 infections. Limpopo has 4 cases and 1 has been reported in Mpumalanga. Has there been progress made in bringing down the transmission of cholera and reductions in the mortality rate? Well, to discuss this further, we are now joined virtually by the Deputy Minister of Health, Dr. Sibongiseni Dhlomo. Deputy Minister, it's wonderful to have you. Thanks very much for joining us.
Good morning, Leanne, and good morning to the SABC TV viewers.
So, Deputy Minister, as things stand right now, can you confirm 43 is still the number that we are reporting of deaths related to cholera in the country?
Yes, indeed, Leanne. As of the statement that we released 2 days ago, we are releasing this, Leanne, with the hope that it is the very last update we are doing on this cholera outbreak, because over the past few weeks, Leanne, we have seen the number of admissions and suspected cholera cases significantly reduced in our country. We have even closed that hospital we call the Kanana, in Kanana, which was a hospital, a field hospital, because we are noticing that we have really reduced significantly the numbers of cases. The figures that we have quoted are actually correct: 1,045 of both suspected and their deaths, together with those confirmed and suspected, together with 197, the hardest hit being Free State and Gauteng. We still maintain that it's largely heavy on Gauteng. It was largely heavy on Gauteng and Free State, because the cases that we have reported on Northwest, Limpopo and Mpumalanga were actually, people who had actually been in Hammanskraal, and therefore they traveled into those provinces with the cholera there.
Yeah. Now, we obviously were, it seemed that at one stage we were reporting infections and then unfortunately fatalities on a daily basis during, a certain week and time here in South Africa. So I suppose the question is, are we seeing a rise in infections, in these cholera infections and related deaths, with Gauteng accounting for the most of them? When we look at the picture right now, have things stabilized, or are we still seeing a lot of infections happening?
We are seeing, Leanne, a significant decline, and of course the closure of the field hospital, which was situated in and around the heavily affected area, Kanana, is a significant move, because we think it is indicative that the cases have significantly declined. And number 2, we are not picking up as many even in the other provinces. And also I must actually give credit to the awareness campaigns supported by the councillors and all of us with the messages of personal hygiene. But also we must thank them, the support from Water and Sanitation Department, who are looking very hard as to what could have been the source, because in any situation like this, the source is water contaminated or food contaminated. So we have actually been sending advices and request warnings to say, I could have been a cholera carrier, and please, when I'm preparing food, I must actually wash hands. When we are coming in from the bathroom, please wash hands, so that I could still remain with my cholera in me, which probably is not affecting me, but I should not spread it to other citizens of the country or in social gatherings where I might be preparing food, like funerals. So those messages, I think they are actually getting some yield and supporting us in the campaigns.
Deputy Minister, we see that from your report you're saying that the case fatality stands at 3.5%. What exactly does that mean? Does that mean that in terms of cases and the fatality rate, you work out that kind of statistic? Is that where we get that from?
Yeah, we have to report that very truthfully based on the number of cases that we had compared to the 43 of the patients people ended up dying. Because the World Health Organization would want that report from us. Their case fatality expectations are much lower. on the country like us, a country that already has never had cholera for the past 15 years. Now it's an outbreak that is actually coming in on a country that we thought we had done well with this because of pipe water. So we need to report that as a case fatality to compare that with what actually is happening in the world as expected from the World Health Organization. So that case fatality is actually an expected report that we need to do because that data will be necessary in the country, in the world to report. We recall we have not had cholera for the past 15 years, endemic from other countries around us. That is why the first cases in February were some of the citizens who came back from their country, Malawi, and ended in Ekurhuleni and Diepsloot in Johannesburg. So that was the first alarm of this is cholera again.
Yeah, and that's, we saw that was, it was a big issue, and certainly one that the president even admitted that when we talk about the Tshwane situation and the whole water issue there, that the government certainly did drop the ball on that one. So we can talk about the whole issue around trying to treat the patients and the fatality and counting the number of fatalities, which is very, very tragic. But I suppose it's getting to the root cause of all of that is what is needed and is urgent. Have you been updated? Because I imagine that this is not a one sphere operation. Every department needs to be a part of the long-term solution to all of this. Where are we at in trying to get rid of cholera, something that should not be there in the first place?
Yeah. Look, I think, Leanne, we should be very commending the work, the strides that have been done, that at least 80%, over 80% of the citizens of our country are receiving piped water, which is safe and good and clean for human consumption. We must think this is a wake-up call and a reminder to all municipalities that we sit on the receiving end as health if they do not provide. So it gives the legislative requirements of municipalities to support and give citizens clean and safe water for consumption. We are grateful, therefore, that the Water and Sanitation Department, led by Minister Mkhune, has come into this space, because the Mayor of Tshwane did admit that they do have piped water in and around Hammanskraal, but the water is not safe and is not for human consumption. Hence, then there was a provision of water tankers to give them support on that. So we think what we do as a department is just to pick up on the failures of some of the issues that are supposed to be held very strongly, clean and safe water for consumption, which is a domain outside our space. But we are confident with the coming in of the Department of Water and Sanitation that the progress has been made. There's been a provision of water tankers as a start, but continuously examining and testing the water and the water treatment plants as to where the leak could have been. And that progress we keep updated. We haven't received a final update thereof on this matter so far.
Okay, so still waiting on that, and we are hoping it will be sorted soon. But are there any additional preparedness plans or measures that the Department of Health has actually put in place for future outbreaks of cholera or waterborne diseases? Because we don't want these deaths and lives to be lost in vain. The fact that it happened is a tragedy on another level, but to have it happen again is something that needs to be prevented. So what kind of preventing strategies have been put in place from your side?
Leanne, from our side, we do give health promotion, health preventive disease programs. Like to say, we do understand that 80% of our citizens have clean water and safe water, but the balance of 15 to 20%, please, can you make sure that you continue to boil your water in the event that it is coming from an unsafe source? Can you maybe, if the water also is difficult to boil, continue adding a household jig in a 20 liter of water, add about 2 spoons, and keep that standing for 2 hours. It's safe for use. So those are messages that we give for now. And again, to say, for now, as a country, we've given a protocol to all our healthcare workers. Any water diarrheal disease treated as cholera until proven otherwise, because this is a fast dehydrating disease, and therefore we do not want to lose and miss people for an hour or two while they are waiting. So we are just giving those preventative messages that we hope are yielding some results in the country and in the area that were heavily affected.
Yeah. Minister, just sort of as we start wrapping, I know one of the things that the department has said is that the majority of positive cases and deaths had casual links with funeral service attendants in the outbreak areas. So, when you talk about the awareness campaigns and the public adhering to your call to maintain strict compliance and, with personal hygiene you've spoken about, especially during the preparation of food and social gatherings and funerals, these are the big issues that people need to do themselves to look after themselves. But it was also the issue of some of the water tankers that were delivering the water to the areas, that there was, suspected contamination in this water. Have investigations come out with regard to that? Do we know if they were perhaps adding to the problem?
Thanks, Lee. And this is what was picked up by Deputy Minister Mahlobo and Deputy Minister Shabalala when we were together there as deputy ministers. And therefore, they were able to go to the actual place where the water tankers were sourcing the water from. And they could actually indicate and pick up and check that some of the water tankers were not really picking water from the right source. And therefore, that could have been another reason. So by the time we left about 2 weeks ago, in fact, the reports were coming in that now they can confirm that all water tankers supporting people in and around Hammanskraal, now that the water in the pipes are still not safe, is from the right source. And that made us very comfortable. And I think that's among other things that we could actually give as an added benefit for being there as government and be able to do the checks and make sure that people who are giving us a service are not doing shortcuts, because for them is to supply water, not aware that any unsafe water to citizens is not going to really be a good source of comfort. So I think that also behind us is giving us that confidence that we are really winning the fight against cholera in and around Hammanskraal. And we call all our service providers of water tankers to be very fair and really be conscious of this issue that they do. If they don't provide us in the country with good, safe and clean water, then we really suffer consequences of waterborne diseases. And then we don't, unawares as health, we must now rush and help and see what we can do in those areas.
All right, Deputy Minister, we leave it there for this morning, but thanks for the update. That was Dr. Sibongiseni Dhlomo, the Deputy Minister of Health, speaking to us about the progress that's been made in bringing down the transmission of cholera and reductions in the mortality rate currently.